I've heard a couple of recommendations for things that maybe are missing from online ADHD educational campaigns. Having clear calls to action, maybe having clear next steps for people of where they should go to engage with the program, more resources for parents of a certain age group. Is there anything else that you guys think is specifically missing from the educational campaigns that are out there right now, or is it just we need more education, or are there specific aspects of the campaigns that are missing?
I'd say that we need more resources listed of where exactly do you go for help. So a number of us have online presences where we have directories and other ways to find specific help in your area. I get, and I'm sure the other panelists here have the same problem, we get emails constantly from people all over the world or nationally, where do I go to get my son tested? Where do I go to get myself tested? And if you don't know where to go, you could get taken by unscrupulous people out there, or people who just are very naive about how do you evaluate and treat ADHD. We see that especially in adults, because there are more and more clinicians working with kids, but not so many for adults. And like what you said earlier, young adults, it's just a big gap of who's the right person to see, who do you go to. And I would like to see more references on some of these larger websites for resources that are credible, like going to our sites where we have resources that people can get help that we know are credible. I hate the idea of people being sent to like Scientology types of websites where everyone is saying medication is bad for you, psychiatry is bad, and all that sort of thing. It's just kind of a scary gap in what I'm seeing. I do see links to some other nonprofit organizations, which is a good start. But sometimes even those are lacking. They may not have specific information for getting specific kinds of help.
Or they're not up to date.
Oh, yeah.
You can follow link after link after link to try to find something in your area and, end up with something that, quit, a group that quit meeting 10 years ago, and it's still listed there. But I don't know if there's any easy answer to that.
Yeah. Well, I think also talking about what Terry was talking about, we can educate people who have ADHD about ADHD, but if there aren't professionals out there to serve them, it's kind of pointless. And I know it's improved over the past decade, but even, psychologists, psychiatrists, family doctors, it's still really hard for somebody to find a medical or mental health professional who knows how to treat ADHD, especially adult ADHD.
Mm-hmm. Okay.
Another thing that's really missing, and I don't know if some kind of online ADHD educational campaign could ever address this. This might be a huge issue, but parents don't seem to know what's available as far as services for their families beyond evaluation and treatment. Things like respite care, so that parents can get a break. I believe that Medicaid has different programs in every single state as far as what they pay for services for kids with ADHD and their families, in-home therapy versus therapy in an office, and whether or not there's coaching available versus just traditional therapy in an office. But that's a huge thing that people don't know if or what resources are available through places like Medicaid.
There's also, when you're talking about the young adult age group, there needs to be more information out there for educational support. So if these young adults are trying to get through college and are falling apart, it's amazing how many people don't even know about the disability offices that are available to them to get support for their ADHD.